Exciting new research has shown that certain probiotics play a real role in increasing bone density naturally without drugs. The key is it's not just any probiotics that have been found to increase bone density, it's certain probiotics that are found in a few probiotic supplements, not in all probiotic supplements, and not necessarily in the foods we think of as being probiotic foods. So stay tuned. If you click off now thinking, well, I'll just start adding more yogurt, kimchi, or kefir. Did I say that right? Kefir? Or I'll just start including my regular probiotic supplement. If you do that, you'll miss the point. It's certain strains of probiotics that have been found to work well for bones. I'm bringing on Dr. Denise Shastek to talk about this, including the science behind it. Let's get right to it. Okay, welcome back to Dr. Denise Shastek. I'm so excited to have her here. It's been a while since we've done a video together, so take it away, Dr. Shastek.
Oh, Glory, thank you for having me on your show. It is wonderful to see you again. And I'm sure that many of our viewers would say the same thing because there are people out there who've said to me, say hi to Glory for me and thank her for all that she's done on this topic of osteoporosis. So it's good to be back.
All right, so this is so exciting when you reached out to me about these studies that are done on certain probiotics. So it's easy to take a probiotic, it's easy to buy them. It's just we have to know which ones. But I think you want to talk about what's going on with the studies and what they found. And I have found that many of my viewers do want to know the science behind these things. So when I get the links from you, I'm even going to have in the description box and in the first comment, I'm going to have links to the studies if they want to do more research. So tell us all about it.
Yeah. So, Glory, you're right. This isn't as simple as just buying a bottle of probiotics over at Whole Foods. And I like studying bugs. I like studying probiotics. And lo and behold, one day I just kind of fell into this and started doing a deep dive and discovered there are microorganisms that have been studied in clinical trials and that have been proven to increase bone density in animals and humans.
That's amazing.
It is. It
Yeah.
is. Yeah. I went a little further and just to give people a little background on probiotics. The word probiotic actually means for life. Pro means for, bios means life. And they use this term because it signifies that there are live microorganisms inside of us that have a very positive effect on our health.
What more do you want to tell us about these? Do you want to talk more about probiotics or do you want to get right into the studies about bone health and bone density?
I'll say a few more words about the probiotics. These are organisms that are alive in our gut, and they are considered very beneficial, especially for digestion. Most people know about this because maybe they have had yogurt or kefir or sauerkraut, kimchi, things like that that are fermented. And it's wonderful to continue to feed that friendly bacteria in the gut. Some of us and some of you may already know that these microorganisms actually make vitamins inside the gut tissue, or they upregulate the absorption of vitamins and minerals. And I think that's where we get our greatest bang for the buck. So, for instance, a lot of women are taking vitamin D for their bones. And there are some very specific good bacteria. There's two of them, Lactobacillus rhamnosus and Lactobacillus reuteri. Both of these increase the absorption of vitamin D in the gut tissue, and they regulate something called the vitamin D receptors.
Hmm.
It's fascinating, yeah. And, some people already know, like vitamin B6, it's produced by certain bacteria in the gut. Biotin, vitamin B7, and they say that 20% of our gut bacteria produce B12. The studies that I've seen are out there, and there are several studies, and they show promise for these bacteria or these good probiotics playing a very real role in bone density.
YouTube hasn't been showing my own subscribers when I have a new video, and they've been doing this since like the fall of 2023, a long time. If you want to be informed when I have a new video, please sign up for my newsletter. I only send the newsletters about twice a month, although I probably should start sending them once a week. When you sign up, I'll also give you my free 3-page anti-aging tip sheet, which is filled with ideas I've used to feel better, be healthier, and look younger. To sign up, I'll have a link for you in the description box and in the first comment. Or you can go to my website, GloryB-TV.com, and then click the button next to my picture that says Get the Tips. On the next page, type your email address, click the pink Get My Tips button, and you'll get the tip sheet, and you'll be all signed up. Now, I was keying up at the beginning of the video saying it's not just any probiotics. So is there something you can tell us about, I'm looking at my notes here. If people wonder why I'm looking down, do you want to tell us a little bit more about what they found in the studies?
Oh, sure. So initially, mice were used in these studies, and they had 4-week studies, they had 8-week studies, and yes, they did dissect the mice, and they dissected the bone and looked at what was growing. And anyway, with these studies, they found that there were very, very specific probiotics that worked on the mice. And so they basically reduced inflammation in the gut tissue. That was one of the ways that this worked. Another way that the probiotics worked is that they would produce things like the vitamin D. They would upregulate vitamin D receptors, or they would make more vitamin K. Ultimately, they reduced the number of osteoclasts that break down bone tissue. So this osteoclast actually breaks down bone tissue, and an osteoblast creates more bone tissue. That's very important for us women facing osteopenia or osteoporosis.
It's interesting when we've talked about what the bone drugs, what most of them do, a lot of them tend to slow down the osteoclasts that break down bone, but then the bones end up having, in a fake way, from a pharmaceutical, they end up having too much old cellular tissue on the bone. And that's why we hear about women who take the bone drugs end up breaking a bone. And that seems counterintuitive. And they weren't informed that that could happen from taking the bone drugs. So when you say that taking these certain probiotics slows down the osteoclast, from breaking down the bone, I think you mean not at the speed that those bone drugs were doing.
All right. This is much more gentle with no bad side effects. It's all natural, and that's what we like about it. And
It's
that's what
not leaving tons of old cells on the bones that make bones break, really.
and you and I have used that term cheap bone.
Cheap bone, right.
Basically created cheap bone. This is not like that.
Right, because when you do the bone density scan, the DEXA, they look better.
Yeah.
They look denser, but it's cheap bone.
Yeah, it's
from
weak.
the bone drugs.
From the bone drugs.
Yeah.
Right? Yeah.
Yeah.
This is all natural. Like as we age, sometimes our digestive systems are not optimal, and we sometimes don't break down our food properly, and sometimes we don't absorb it. I have a conversation sometimes with several women about, tell me about how you're eating. And I hear about people eating, standing up and hurrying up and not chewing their food properly. And you have to stand back and say, well, wait a minute. Are we adding the enzymes to our food properly? Are we breaking the food down, and are we making it bioavailable? And so that's a whole process where, while these probiotics actually assist in that process.
Can you tell us more about the strain-specific probiotics? I mean, they're all like Latin names that I'm not familiar with, but if you can tell us about some of that, that would be great. The ones that are great for bone health that they found in these studies.
I'm going to list a few, and some of you will recognize the genus name. The genus name is the first word of the probiotic. Things like lactobacillus. We get that in yogurt. We get that in kefir. So there's a Lactobacillus reuteri. So the second word is the species. There's Lactobacillus casei, Lactobacillus gasseri, and then there's Bifidobacterium longum, there's Lactobacillus rhamnosus, Lactobacillus paracasei, Lactobacillus plantarum, Lactobacillus helveticus. So those are the few that I studied.
Okay.
And
That were
that
brought
were
up in these studies that were beneficial.
what's interesting, Lori, is would you believe the studies are only 13 years old? This is new. That's relatively new.
Hmm. Well, people haven't been talking about it. I mean, I said in the intro, new studies, but they're new to a lot of people because nobody's talking about this. So we're all just finding about it for the first time, right?
Right.
So then the key is finding probiotic supplements that actually have those particular strains that you
Right.
just mentioned. So
Right.
what have you found regarding that?
Yeah. So if you look at the studies carefully, which I think you're going to put or have attached to this webinar.
Let me interrupt here to tell you that anything we mention, such as supplements or studies that are available for you to read, are listed and linked in the description box and in the first comment. To get to the description box on a phone or tablet, go below the video and tap the word more. That opens up the box a bit. Then you have to tap the word more a second time and the box will open completely. Then scroll down to the section called Products Shown or Mentioned, and everything will be listed and linked there. If it's easier for you to find the first comment, go below the video and tap the word Comments, then tap the words Read More, and the first comment will open completely.
They also have a strain that they used in each individual study. And what I did was, this took hours. I went through almost every maker of probiotics. About 4 to 6 hours later, I discovered that even big brand names don't include the strain number on the bottle. It would
Oh,
require a phone call to the lab, and maybe they would give it, maybe they wouldn't, maybe it's recorded, maybe it's not. So, what I ended up finding out was I found two makers of probiotics that have 4 to 5 of the microorganisms that I mentioned on this video. And so the one is made by our friends, the Garden of Life, and their product is called Doctor Formulated Women's Probiotic.
mhm, mhm.
And I think you'll put a link to that on your,
Yeah.
yeah. The other one is made by Da Vinci Labs, and it's called Daily Best Probiotic. What I like about both of these is that they are in spore form. Now, what
Mm.
does that
Yeah,
mean?
what does that mean?
They don't need to be refrigerated. They're dormant. So they're actually in a spore inside the capsule. And so spores only open up in the environment in which they are intended to thrive. So what that means is they bypass the hydrochloric acid in your stomach. They
Mm.
bypass 98.6 degrees Fahrenheit of our body temp. And when they hit the gut tissue, that's the environment in which they thrive. The spores open up and become active.
Wow.
You do
No
not have
refrigeration.
no
That's amazing.
refrigeration. Yeah.
Okay. And do you know if they say that on the box, both of them? Like this doesn't have to be refrigerated or?
And people probably don't know why, but it's because they're in spore form.
That's amazing. Yeah, I'm gonna go out and buy some. Yeah, you know what I'm gonna do. We talked about too offline the importance of gut health assessment, especially for people who have digestive issues or full-blown osteoporosis, because mine, I'm in osteopenia now, and when I had osteoporosis, it was mild. But there are other people who have other things going on. So we talked about in our notes to each other some other options where people can actually work with you. And I've done this one particular test before with you. Well, I did it at home, but it was through you.
Mhm. Yeah, I test people's digestion and their gut tissue by giving them a stool test. And this particular stool test provides 5 pages of great data. I would be able to tell if you're inflamed. I can tell if you have the right amount of good bacteria. And it'll list different families of good bacteria. And of course, it'll list overgrowth of bad bacteria. And so from this, I can get a really good picture of how is your stomach working, how are the large intestines, how small intestines, and a whole lot of other things in between.
And in the past, when patients have done the stool test, has it led to you recommending that they get other kind of blood work done to look into other kinds of things going on in their body?
Sometimes it has.
Okay.
I've
Other
identified.
times you're just able to recommend certain supplements or food changes.
Right. Recommend food changes, diet changes. I recommend supplement changes.
Mhm.
If someone has Helicobacter pylori, which can really interfere with digestion, we can treat that. If you have SIBO or small intestinal bacterial overgrowth, and there's an overgrowth of bad bacteria, we treat that. And then I meet people who their good bacteria is tanked. And if your good bacteria is tanked, um, you have other health issues going on. You'll have skin conditions, you might have anxiety, you might have all kinds of other unique things that you'd never tie to bacteria at all.
Right. And a regular MD might just treat those symptoms that you just mentioned, skin issues, anxiety, all these things that they might not tie to gut health at all.
Yeah.
But the stool test
Mhm.
shows all this stuff. And if you start to treat not that's well, that's a test result. So you start to treat that, then those other symptoms should go away. And you've
Right.
probably seen that happen a lot.
Oh, yes, I have.
Yeah.
And I think when some of our viewers are not seeing the dial move with their T scores on these DEXA scans, we have to ask a bigger question. What is going on with inflammation? Is there inflammation? Is there a digestion issue? Do you have enough of the good bugs? And so this test could certainly help with that.
Right. And we've had a lot of viewers who were trying to do what I did, that I said earlier in a couple years past, what I did to reverse osteoporosis naturally. And they did those things and they're like, mine isn't reversing. And the other thing is we're finding more and more availability of a different kind of bone density scan called a REMS, REMS.
Yeah.
It's sold by Echolite. And if you go to Ecolite's website, which I'll put a link below, they have a map showing where different doctors or different offices have purchased the REMS Echolite and put it in their office. And I've been on a couple like chat rooms where people are saying, oh yeah, I drove 20 miles or I drove 50 miles or 100 miles to get my REMS. So they are selling more of those, and people say they're a lot more accurate than the DEXA. So you and I are both glad to see that, because I don't want people running from DEXA to DEXA. People have asked me, did you get another DEXA scan? No.
And
I
you know
don't
what?
live in fear, and I don't want to be running from DEXA to DEXA.
And Glory, here's something else I'll mention. For our ladies on Medicare, Medicare will only pay for a DEXA scan once every 2 years.
Okay.
That's too long to wait to figure out, is this natural stuff working? Am I on the right
Right.
track? We like do what Glory and I did. Every 6 months, we followed up until we saw that we were on the right
Right.
path.
Well, you and I you found a place to pay cash and it was $70,
It's
because
still seven.
before I was on Medicare and putting it on my insurance, it was costing me out of pocket $265 because I hadn't hit the deductible. I'm like, I'll pay $70, and then it goes straight to Dr. Shostek and not to my doctor, whose nurse was scared and thought I was dying from osteoporosis. I'm like, no, I'm not dying of osteoporosis. I'm on Medicare now, which I like to say in my videos because I am 65. So that's good to know. But you're right. If somebody's got bad osteoporosis, they might want to have another one. I don't know with Medicare if they're going to pay for the REMS. A lot of women are just paying for it
They don't pay.
cash. They don't pay for it. Okay. You'd have to call Ecolite and find out, maybe they keep their map updated, but if they don't, you want to talk to somebody at Ecolite, say who has the REMS near me, like where's the closest one, so you can get a price and decide if you want to do that as well. But the thing I want to talk about too, if people thought, that stools test sounds like that would be a good thing for me to do. a lot of my viewers have worked with Dr. Shostek remotely, not even necessarily for the stool test, but for other things, and to reverse osteoporosis naturally. And we did at least one video talking about what it's like to work with her. In the description box, there will be a link to her website, the contact page, where they scroll down and there's a form, and you're going to fill that out with your name. I think it's email address, phone number, and then there's a box where you can say, hey, can I schedule a 15-minute call with you? And Dr. Shostek will, you can introduce each other, and find out what it is you're dealing with. You're not going to go through your whole medical history, but you're going to decide if you want to work with her. And it's very reasonably priced compared to other doctors who are working with patients remotely. In fact, one of them who kind of went after me on YouTube, if he hadn't done that, I wouldn't mention it. But I had to do a video in reverse because for him to work with somebody for a year, first it was costing $10,000. Then it was $12,799. He put it right in his website. And then he took down how much it costs. But that's how much it costs to work with him directly. And all of his other programs, you're working with someone else at his office, or you're just taking some online courses, but you're not getting individual help. And I'm saying for the price that Dr. Shostek will quote you, she's working with you individually with your blood work. If you haven't had blood work in a while, you can figure out with her, do you want to go through your MD to get it, especially if you're on Medicare, get your current blood work, possibly get the stool. So she's helped so many people. In fact, she helped one viewer of mine who interestingly was a man. He didn't have osteoporosis, but he had stenosis. And I have a whole set of videos on my spinal stenosis. So he was working with her on that, but she looked at his blood work and put it all together in her head and realized he had a heart condition that none of his MDs had figured out. And she got on the phone with him and said, you need this heart scan now. And he was able to get in for the heart scan, and sure enough, he had a heart condition, and the next day he was having heart surgery. So no other doctor saw this, even though they also had pieces of his blood work and pieces of his whatever scans he had had. But I thought that was an amazing story. You didn't see his heart scans, you saw his blood work, and that was amazing, connecting the dots, and you saved the man's life. And I think that that's worth even more than you charged. But anyway, I'm just saying, I think it's worth it to work with Dr. Shostek. So, whenever you're seeing this video, this is why I'm not quoting her right now, because you might see this video 2 years after we're filming it, and her prices might have changed by then. So you need to contact her on that page, and she'll reach out to you and set something up.
Yeah. Well, I hope we've been clear about probiotics, very specific probiotics, and the role that they play in supporting our health. And I do recommend that if you've got osteoporosis or osteopenia, follow her links, get on one of these probiotics. It's not going to be something that we just magically see everything change in a few weeks. Be consistent, stay the course, and then if you're not improving, give me a call. Let's see if we can drill down and find out what the problem is.
Right.
Because remember, osteoporosis is not just about you're taking your calcium.
No.
Right, Glory?
It's not even just about taking supplements, including probiotics, period. It's exercise and it's food. It's what you're eating. Yeah. It's what you're eating. Some things need to be eliminated and some things need to be added. But I talk about that a lot on my channel. And this is why, even in the midst of a lot of stress in my life, I should look like I'm 85. I really should. If you knew the stress that I've had, even going back to 8 years old. But certainly in the past 5 to 10 years, you would be like, oh my gosh, why do you not look like you're 85? So I don't. And a lot of it is this combination of what I eat, what I don't eat, and the supplements I take, which I change every now and then, and I do a new video, and then the exercise. which a lot of things I'm limited now because of that spinal stenosis. I used to run. I had to stop running. Then I was doing race walking. I had to stop that. So, because of the motion that it does at that particular part of my spine, but I'm not in pain anymore because I worked a lot. Well, it was a combination of two things, right? It was the physical therapy exercises, and then you, with the spinal stenosis, you led me to a homeopathic treatment. At first, I was like, I'm not taking that. Homeopathy, schmopiopathy. No. And then I read the article you sent me, and I'm like, okay, this is so cheap. I have nothing to lose. I'm going to do it and give it 6 months. And that's what I say with osteoporosis. You've got to give, when you change things, you've got to give it 6 months minimum to see if it's working.
Yeah.
Right? The food
That's
changes, the drink changes, the supplement changes, and the exercise changes. It's like your new hobby. All right.
that's
Is there anything else you want to add?
I just want to say thank you, Glory, for creating this whole series on osteoporosis. Several women have had excellent results on their DEXAs, excellent results with supplementation. We're seeing the dial move. People are feeling more confident. They're feeling better about themselves. And it's because of your work that you've done. So thank you so
Yeah.
much.
And
And
you're
I'm glad
talking about my viewers.
your viewers, yeah, they
Yeah,
reach
who reached out to you and worked with you. So you were able to see the before and after.
us.
Mhm. Thank you so much, and we'll talk to you next time.
Thanks, Glory. Good to be with you.
After Dr. Shostek and I ended the recording, we kept talking. And in particular, we were talking about things she's seeing in her practice with my viewers who are coming to her and working with her as a patient. And one of the things we're finding is that mold is getting into people's systems, and that is causing bone loss, or it's stopping the body from building good, strong bone. So in the future, we want to talk about that as well. There are so many ways that mold gets into our lives. Some of it is environmental in the house. Some of it is from the food we eat. She's also seen some patients eating too many sardines, too much salmon, and those fish, when you eat it in that levels, they're filled with arsenic. And there was one other thing she said they're filled with, and now I'm forgetting what it is. But the woman's body was filled with those kinds of pollutants that are in those fish. So yeah, eating sardines, you'll get some good calcium, but there's a cost. So we want to look at those things in the future. Make sure you subscribe and stay connected with my channel. And we'll see you next time. Check out one of my other videos by tapping its image on the right side of your screen. And I'll see you in the next video.